All right, welcome to the deep dive. Today, we're zeroing in on something really practical, especially if you're revising. We have these revision notes here, all about one specific condition.
Yep, and our goal is basically to break them down, pull out those absolute must-know, high-yield facts for you, make revision a bit easier, hopefully.
Exactly. And the condition we're tackling is nickel dermatitis. So, based on these notes, let's start right there. What is nickel dermatitis?
Okay, so at its core, it's an allergic contact dermatitis. It's triggered, like the name suggests, by skin contact with things containing nickel.
You get the redness, the itching.
Yeah, skin lesions, that sort of thing.
And the notes really highlight it being a type 5e hypersensitivity reaction. Why is knowing that specific type so important for revision?
Ah, that's really the key mechanism. Type IV means it's delayed. It's not an immediate zap reaction. Nickel gets through the skin, binds to proteins.
And the body sees that complex as foreign.
Precisely. But the reaction takes time to build up, shows up later, like 24 or 48 hours. That delay is classic type 5, really important distinction.
Got it. The delay is crucial. Okay, and sources. The notes mention jewelry, which, well, that makes it super relatable, doesn't it?
Absolutely. Earrings, necklaces, watches, even belt buckles or jean studs. Everyday stuff.
So who's most likely to run into this problem? The notes list some risk factors.
Right. Obvious one. Having a known nickel allergy already. Also, a history of atopic dermatitis seems to increase risk, and critically frequent exposure.
Like in certain jobs.
Exactly. Occupations with lots of metal contact. But there's a really fascinating point in the epidemiology section of these notes. The gender difference.
Oh, yeah, I saw that. It's quite stark, isn't it? Overall prevalence, maybe 10, 20%. But then in the UK, it jumps to like 20% for females versus only 6% for males.
It is a huge gap, and it really points back to, well, different exposure patterns, doesn't it? Likely linked to jewelry use being traditionally higher in women.
Makes sense. So can you quickly summarize the pathophysiology? How does the reaction actually happen on a cell level, based on the notes?
Sure, keeping it brief for revision. First, you get sensitized. That nickel protein thing teaches the immune system, hey, react to this.
Right.
Then next time you're exposed, those memory immune cells kick into gear, release chemicals, mediators, and that's what causes the rash, the itchiness.
Sensitization, then activation.
Yeah.
Got it.
Yeah.
So clinically, what does this actually look and feel like for someone?
The notes describe erythema, that's the redness, and pretty intense itching, usually right where the nickel touched the skin.
And the rash itself.
It's described as an eczematous rash. So that could mean little fluid bumps, vesicles, or maybe raised spots, papules, or sometimes just dry, scaly patches.
And common sites mentioned line up with the jewelry thing.
Yes.
Earlobes, neck, wrists, abdomen for belt buckles, maybe?
Exactly those spots. And the timing fits the type 5 thing. Again, symptoms typically pop up 24 to 48 hours after the contact.
Okay. But other things can cause rashes. How do the notes say you differentiate nickel dermatitis from lookalikes?
Good question. The differential diagnosis list includes other allergic contact dermatitis, causes, think fragrances, latex, also irritant contact dermatitis, which is an allergy-based.
And other types of eczema, like atopic.
Yep, those too. So you need a way to confirm it's actually the nickel.
And the notes are clear on that.
Yeah.
The gold standard investigation is.
Patch testing, no question.
Can you briefly explain what that involves?
Sure. Tiny amounts of different common allergens, including nickel sulfate, are put on small patches applied to the skin, usually the back.
And you wait.
You wait a couple of days, then check for a specific reaction right under the nickel patch. Confirms the delayed hypersensitivity to nickel.
Okay, diagnosis confirmed via patch test. What's the absolute #1 management strategy stressed in these notes?
Avoidance. Simple as that, but maybe not always easy. It's the cornerstone.
So choosing nickel-free jewelry, hypoallergenic options.
Right. And the notes mention practical tips like using clear nail polish as a barrier on metal bits, checking labels on products, being vigilant, basically.
And if someone does get a flare-up?
Topical corticosteroids are the go-to mention for calming the inflammation, reducing the itch, standard stuff for dermatitis flares.
What about the long-term outlook, the prognosis?
Generally good if you can avoid the nickel. But, and this is key, the notes emphasize that sensitization is persistent. Lifelong, really.
So get exposed again, you'll likely react again.
Pretty much. That's why long-term management is all about consistent avoidance. It doesn't just go away.
And are there any complications mentioned?
Yeah, a few potential ones. Secondary bacterial infections if the skin gets broken from scratching. Chronic dermatitis if exposure keeps happening.
Which must impact quality of life.
Definitely. And in really severe cases, the notes mention needing stronger stuff like oral steroids or even immune modulators, but that's less common.
Right. Okay, wow, that covers the notes pretty thoroughly.
Hmm.
So just to hammer home those high-yield revision points, type IV reaction, remember the delay. Patch testing is key for diagnosis, and avoidance is the absolute main management strategy.
Couldn't say it better. And thinking about it, while avoidance is the clear path, the fact that the sensitization sticks around forever, it makes you wonder. Nickel is in so many things, not just jewelry. Coins, keys, tools, even some foods. How much does constantly navigating that, avoiding triggers, actually shape someone's daily choices and anxieties beyond just the visible rash? Something to think about.
That's a really insightful point to end on. And for anyone wanting to dig deeper or find more revision aids, the notes pointed towards passthemethra.com and also freemethra.com. Definitely worth checking out. Thanks for joining us on this deep dive. Keep learning.